Good morning, everyone. Today I want to talk to you about wisdom teeth surgery and some common errors or problems that dentists get stuck into when they're performing wisdom teeth surgery. So first, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my own practice, Lakeside Dental Spa in Harvey Bay, and I've been running my practice for the last 14 years. I took it from 1 chair to 10 chairs, and we started with team members of 3 staff members, and now we have close to 40 staff members. Also, for credibility, I used to run beautiful wisdom teeth life patient training courses in Malaysia and Cambodia with the help of amazing, talented maxillofacial surgeons, Dr. Firdaus and Dr. Anthony Go from Singapore and Malaysia. Very successful course. We used to train a lot of general dentists from Australia, and I'm still in contact with many of them. And so, common things that I get from a lot of dentists, general dentists performing wisdom teeth surgery, whether upper wisdom teeth, took them an hour to 90 minutes, and they have to bring another dentist to help them, or the principal is coming to help them, and they also spend another hour and they couldn't take it out. Lower wisdom teeth as well, spending a long time trying to remove them. Air emphysema in some cases, leaving roots behind, big roots, not like root tips. Just finding the whole procedure really hard to manage. And I gathered some thoughts that I have in the process, and also patient complaints. And my thoughts is the problem with general dentists is sometimes they don't practice like surgeons. And if you watch a maxillofacial surgeon performing wisdom teeth and watch a general dentist trying to do wisdom teeth, there's a big difference, and I will tell you the difference straight away. And also they treat wisdom teeth as normal teeth, like lower 6s and lower 7s, or upper 6s and upper 7s. And to be honest, lower teeth has different anatomical landmarks around them and need to be treated differently completely than any other teeth. So error number 1 is they try to elevate fully grafted teeth, lower fully grafted teeth. Again, you'll hear some dentists, especially experienced dentists, like, oh, all my life I just elevate them, they come out, no problems. If you talk to a lot of surgeons, especially if you don't have the experience, they will recommend opening a flap, guttering buccal bone before you elevate. The reason is that you can have a very thin lingual plate, very thin, and very thick cortical buccal bone. And if you don't gutter and you try to elevate, yes, it can come out, but on the expense of the lingual plate. And if the lingual plate is cracked and it comes out with a tooth, you can injure the lingual nerve very easily, and it can be very hard to defend if the patient has a lingual nerve injury with a numb, has their tongue numb, and in your notes and your records, and if the patient goes to a complaint process and they take a cone beam or MRI, it's clear that you haven't guttered or tried to elevate this pressure, relieve the pressure from the buccal. So I routinely, unless they are perio involved, of course, open a decent flap and gutter buccal bone and the depth of gutter until I get to cancellous bone, so I have elasticity of the bone, so the tooth can come on the expense of the buccal. So not got bitten by an ant. So not guttering buccal bone is a risk of lingual nerve damage, and also it can delay your procedure a lot. Not guttering or tunneling through the distal bone as well. If you still have distal cortical bone, elevation can be very, very hard. Upper wisdom teeth, if you have a large tuberosity and you don't create a buccal window of bone removal, you can break this tuberosity, or you can spend a lot of time trying to elevate the tooth without any movement. So if you have a large tuberosity, you need to open a flap, you need to open a buccal window and deliver the tooth buccally to protect this tuberosity. That's a very common error. Using the wrong instruments, trying to use a handpiece, like a high-speed handpiece with a crown prepared, trying to gutter and section with it. It's hard to access this area in the mouth, so you can cut the cheeks very easily. You need to use a surgical handpiece with a surgical motor, so you can access that area and you can tunnel through the distals very easily and section these areas, and also use saline instead of using water as your irrigation. This will also prevent the problem of having air emphysema. If you have a flap open in these areas, the tissues are not very tight against the bone, and you can easily push air into those areas much easier with normal handpiece. So using the wrong tools is another common error. Another common error is consent. They very casual with the consent when discussing wisdom teeth. I have a special consent form for wisdom teeth compared to normal extractions. And I draw on it where the nerve is, I draw where the tooth is, I write the risk of lip and chin numbness or IDN nerve damage. I discuss leaving root tips behind if it's close to the IDN. I also discuss that you can see an oromaxillofacial surgeon, and I can refer you to one and write if they declined or they want to see a surgeon as well. All of this is written and drawn, so the patient cannot come back and say, I was only handed the paper, I didn't understand it, and I just signed on it. When you have all those drawings, it will protect you if there is an adverse reaction. Over promising and under delivering, so telling the patient you'll be fine, it's an easy surgery, you'll be out in no time, I'm really good in wisdom teeth surgeries, then you end up spending an hour and end up with a lingual nerve damage. Other way around, I under promise and over deliver. So I tell them it's a surgery, it's very close to your ear, you'll hear a lot of noises, a lot of crack noises, you'll hear a lot of cracking, it can take a long time, sometimes I might not be able to finish it and end up referring to a specialist. There's a risk of numbness and lingual nerve damage and all of those risks. Then if you end up doing it in 15 minutes, you look like a hero. Patients will be very happy with your treatment. But if you end up with an adverse reaction that you discussed that can happen, then the chance of complaining will be much more less because you already prepared them for the worst. I can't think of anything else, but if I do, I will probably write it in the comment section. If you have faced with some problems, please share it with me. Please also watch my videos on wisdom teeth surgery. I have videos on mesioangular, disioangular, and probably maybe fully erupted, where I made a lot of mistakes in that video to share with you. That's early on in my career. If you find this information helpful, make sure you like and share it. Please subscribe to my channel and turn notification on so you can get notified when I release more videos. Thank you so much for listening. It means a lot to me.